name is Dr. Alice, and I'm a liver specialist from Sydney. Do you know why you're here today? You married?
No.
No children?
Not yet.
Not yet? Do you have a partner?
Yes.
Okay.
Yes.
Has your partner been tested?
No.
Has your partner been vaccinated? Was your partner here when the screening was being done back then?
No.
Okay. Can I suggest that your partner be brought in for testing? Just because you have the virus doesn't mean that this is going to kill you and you're going to be impacted for the rest of your life. You can have a very normal and healthy life and grow to be a great grandfather, okay, as long as you take care of your overall health.
Thank you, everyone. I'm so honored to bless the food. Let us pray. Heavenly Father, we thank you for this wonderful evening, and we thank you for uniting us together. Your blessing, you blessed us all with this food. Please bless the food and bless our hands that prepare it. Give us and enrich our body and our minds so we can carry out the missions that you sent us to this earth. We ask this in your name, Jesus, our Savior. Amen. Amen.
My name is Eddie Akawola. I was born and raised in Tonga, and I moved to Niue in 2011, July 2011, as the Chief Medical Officer. And later in 2018, they also appointed me to the Director of Health role. Thank you very much, everyone. The dream is almost become a reality now because Hazel and I, we have written to WHO to ask them to declare hepatitis to be eliminated from Niue, and hepatitis, so viral hepatitis top of the list.
The ability to eliminate viral disease like that, it's a first step, but it shows there's a path. And then you start to think about other viral diseases. If we can get to that point, it's a pretty dramatic shift.
Hepatitis is one of the most devastating diseases on earth, but it's also one of the most preventable and treatable, with services that can be delivered easily and cheaply at the primary healthcare level. And several countries have participated in hepatitis elimination pilots, which will help WHO establish the validation process for certifying elimination. However, despite these successes, most countries are still not on track for elimination by 2030.
So I'm a survivor of viral hepatitis. I had hepatitis C nearly all my adult life, and I had a couple of rounds of treatment. I got very cirrhotic very early, and by the time I was 52, I'd reached the point I'd used up all the redundancy in my liver and had tipped over the point where my liver could cope. It's called decompensated cirrhosis. But I was very fortunate to, quite soon after getting the word that my time was pretty much close to running out, I came across an Australian buyers club run by Dr. James Freeman, and I was able to access these wonderful new medications. I took them for 24 weeks and my whole life changed.
Hazel sort of came to, she came for treatment initially. So she had failed the old treatment. So she was pretty near death at the time. She took the treatment and that's fine, and she really got cured. But what's different from most patients is that most people are absolutely silent about Hep C and having it. And she went public about it. I thought it was a very brave thing to do.
We all caught it by accident. It's an accidental thing. There's no blame in it. There should be no shame or stigma in it. I faced a lot of discrimination in my dealings pretty much every time I encountered the health system in the early days.
You can't underestimate what discrimination people feel when they live with viral hepatitis. And to me, that's one of the barriers to people getting tested.
I think awareness that we can not only change lives, but change societies, change belief systems, is combat stigma, combat ignorance. It's, again, I think stigma, ignorance are universal diseases, if you will. And in some cases, stigma and discrimination are worse diseases than disease itself.
Well, we were working with the Minister of Health in New Zealand, and I happened to be in Auckland and walking around, and I see these beautiful posters of butterflies. And I asked around, I'm like, who's putting up these posters? This is amazing. We love these.
The butterfly symbol was, what got all of our attention.
So the butterfly was the brainchild of Dr. James Freeman. He came up with the idea of cutting through all the noise, having a very bright and very attractive symbol that would make people engage in a positive way. And this is really a magic little symbol for that. It really does symbolise that rising up of change and a whole new life, and looking forward to a bright future free of hepatitis.
The reasons people miss out on services for hepatitis are the same as the reasons they miss out on other health services. Accessibility and affordability because of who they are, where they live, or how much they earn.
One of the things people don't recognise is the miracle that was sofosbuvir, which is the drug that treats hepatitis C. It's the key molecule. Prior to that, we had drugs that would treat viruses. So say you got a cold sore or cold sores in private places, we could give you some medication and they would go away. But they weren't cured. So when this molecule was developed, it was an absolute breakthrough moment. It's a penicillin moment. So it's our first ever cure for a virus. And what it did was open people's eyes to the fact that if you get it right, you can cure stuff. So potentially we could cure HIV, potentially we can cure Hep B. And this has shown that it is possible if you get it right. So that was truly remarkable. And I think people have missed that this is literally in the order of as important as the invention of penicillin.
I had all these patients who were dying, that there was no treatments funded through Pharmac, and the treatments that could be purchased were just so prohibitively expensive that patients couldn't afford them. And this opportunity that showed such fantastic results in clearing the virus, and these drugs had minimal side effects, whereas the drugs that we did have available at the time, it was a treatment you went to hell on to get well.
I hate it when I see there are better treatments available elsewhere and we don't have them. Here was a drug that was available just across the ditch in Australia with an almost 100% cure rate, while our patients really had to still suffer. And because I was at the front line with Margaret, seeing our patients going through this horrific old treatment, knowing there's something new there.
And the societal cost to the society as a whole, because they're more tired, because they're actually more likely to miss work, was 10 to 20 times higher than the direct cost, actually. And by direct cost, I mean the actual cost of buying the diagnostics, the treatment, and the cost saving from hospitalization.
No one else was telling people what might save their life. So I was alerting people to the Buyers Club. It's lawful in nearly every country in the world to import any medication that you need for 3 months' supply. Global Health New Zealand came into force so that we could have capacity to fundraise, do larger projects, but we've used it really to focus on viral hepatitis elimination. I fundraised for all of this privately through the Edmund Hillary Fellowship. We had some wonderful donors. I was made an Edmund Hillary Fellow in 2019, and that was right at the time we decided to try for this.
We use, I think, some general fundraising mechanisms, if you will, to try to get going more quickly. But beyond that, again, she had a very well-defined plan with a fairly modest amount of funding required to go try it. And so I got pretty excited about how to try to help her achieve that.
The forerunner to Global Health New Zealand, we had this NGO Hepsi Action, and my colleague who helped me with that was Kaumatua Anaki Goodall from Ngāi in Christchurch.
A number of years ago now, quite a few, I've forgotten, let's say 5, 6 more, I got a surprise diagnosis of having hepatitis C. As the universe would have it, I met up with Hazel, who happens to be the daughter of Peter Heel, who I'd worked with in the Ngāi Māori Trust Board days back in the late 80s. So just a lovely coincidence of connection there. And of course, Hazel had been down this track herself a year or two ahead of me. And but she immediately opened up the doorway to my understanding of what was happening in the background.
He came here and it's such a beautiful place. He got talking to some of the people locally and he came back and he said, couldn't we do a whole country? Couldn't we do a whole island? Because the World Health Organisation has set the target of 2030 to eliminate viral hepatitis from the world.
I knew Sir Colin Tukuhitonga. I got in touch with him and asked about the Niue question, and we were just interested in this idea of could we identify a discrete population that could be treated, learn on the way through, obviously do it appropriately for the community as well, and get the results. This can be done. It's not necessary for people to die of hepatitis.
2030 targets are important because it gives the world a focus and a way to really measure our progress. We know we have the tools to eliminate hepatitis B and C. For B, we have an effective treatment and a vaccine. And for hepatitis C, we have very effective tests and a cure. So by keeping our eye on the 2030 targets, we can all work towards a future without hepatitis.
In places like New Zealand and Australia, we have high rates of hepatitis C, smaller rates of hepatitis B. But if you look at our Pacific neighbours, they have lower rates of hepatitis C, but very, very high rates of hepatitis B. In fact, they have the highest rates of hepatitis B in the world. And hepatitis B and hepatitis C are the leading causes of liver cancer and liver death around the world. So if you live in the Pacific, be it Tonga, Niue, the Cook Islands, or Samoa, your risk of having hepatitis and of dying from hepatitis is more than 10 times that for people living in Western countries.
These are not trivial viruses. The risk of developing cancer from hepatitis B and C is actually the same as if someone smoked 1 pack of cigarette per day. So we go into debates about, well, we need to screen people and we need to treat. I think the other aspect that's very unique about hepatitis B and C is that the elimination of these infections are cost-saving. Most of the countries that we work with are struggling, and what they're worried about is how do we pay for it? And then the second part is how do we actually implement? And that's where Hazel's program was so important, because they actually went and showed them how to do the screening and treatment. And that's what countries need. They need actually navigators, country navigators, to go in there and actually help them develop these elimination programs. The one thing that's common across all the countries who are on path to elimination is a commitment to action.
My name is Alice Lee. I'm a professor of medicine, a gastroenterologist and hepatologist, which means I deal with gastrointestinal diseases and liver disease. I'm based in Sydney, and I'm a clinical lead in one of the teaching hospitals. I take care of a lot of people with liver disease, including liver cancer, complications of chronic liver disease. I had the fortune of setting up a small organisation called Hepatitis B Free about 10 years ago. And this organisation has allowed us to support some hepatitis B needs in the Pacific Islands. And where it becomes evident, we also work with supporting hepatitis C needs as well as other forms of medical support as requested by our partners in country.
My name's Sue Huntley. I am a director of Hepatitis B Free, and the organisation started 10 years ago when Alice asked me if I would like to accompany her to a remote PNG village to immunise that village with her. So what we've seen across the Pacific is when there's a high incidence of hepatitis B infection, people will die sooner.
My name is Sione Limba Mawaitangi. I'm from Tonga, and I'm a nurse at the Niue Hospital. Still remember growing up, like on my mom's side, it's really strong, the disease on my mom's side. At the time, we don't know what it is. We only know it's a liver problem. They always got sick. All of them have the same thing. All the bodies start wearing away, muscles wearing off, and big tummy and turn yellow. It was scary, like trying to go help them, but every day, every night, you hear them crying with pain, and slowly you see the blankets we keep on them start turning yellow, all their body starts shrinking, but the tummy gets big. If you know a family member gets it, it's pretty much end of the line for them, and like there's no more hope because we don't have anything else to give them at the time.
26 degrees at the airport. Should be nicely on time as well, just on the gate, around about 35 minutes past midday. Thanks so much for choosing to fly.
It's been a real privilege to be in Niue. It's a very small island and the population is less than 2,000. When I heard about the rates of Hep B in Niue, I was blown away because a nationwide sero-survey that was done showed that we've got less than 0.5% compared to the rest of the Pacific Islands where the rates are ranging from 7 to 15, 20% in some places. And a publication in 1983 shows that Niue had a prevalence of hepatitis B of 11.9%. And that was from a sero-survey done with most of the nation surveyed. So it's a similar kind of scenario. So, wow, something happened in the last decades where they drove that rate down from nearly 12% to less than 0.5%. And so we started to ask the question, what is it that is unique to Niue?
I was one of those people who helped start up the program with the immunization. And that was something about 1985. There was a group of people who came from Melbourne, and they did a survey and they found out that Niue is one of those countries who have a high, either you are infected or immune. So from that, they started the immunization program and they provide us the vaccine.
I take my hat off to the leadership and vision of the former government that made the decision. I pay tribute to the Honourable Billy Talangi and the Honourable Sauni Tangatori, who were the two health ministers before I came into this role. It's very lucky to be in the position where I am when we're at that final closing stage, I suppose, of this project.
People don't know much about hepatitis before the awareness. I was with the public health team at that time, so we did the awareness and then the questionnaire, and we did the testing. The project is a really good thing, especially for us here, because our population is quite small.
Our plan was to test the entire population to see first the prevalence of hepatitis B and hepatitis C, and then to link them to care, to train the staff, and to help provide medication for anyone who may need it. When COVID came to the world, all our plans had to change.
I think the initial project was well intended, but the idea was we come here, we go from village to village, we educate, and we treat. We test, we treat. And now they had to do this themselves. So I think Dr. Eddie and Griselda and Dr. Manu basically had to go out there themselves and say, well, this is what we're planning to do, and we want you, our community, to be part of it. I think that was really a blessing in disguise. I'm pretty sure that that's part of the reason why this project was so successful, because it came from within Niue.
In this project, we were able to get a good proportion of the population come through. And there's only one hospital here. Everyone comes for health services to Niue Hospital.
It actually made a big impact here for us. There's a few patients or a few with Hep B, and it kind of gave us a eye-opener, as in to look more into Hep B and how serious it is in our community.
We are a very small population, and that has its benefits and its cons as well. But in this case, we're very lucky in Niue to be a small community. We all look out for each other. We're all a big family.
Whakalofa Lahi Atu, everybody. A very, very big thank you and hello and welcome. Today we're doing some staff training about what hepatitis is, how it's treated.
Thank you to everybody for having us here in Niue. It's our first time. Our training is to give you a snippet of viral hepatitis and know that all of these resources will be available, and this is really the tip of the iceberg in terms of the resources that we have. And we hope that we can continue to engage online on a regular basis so that you have access to us, to some of our experience, and also to ongoing education as well.
In Niue, the incidence is even below the Australian rate. But in many areas in the Pacific, it's in excess of 15%, which is very, very high and means an early death for a lot of people, unnecessarily at a young age.
Without talking about hepatitis, we need to know what does the liver actually do? Where is the liver? What's the function of the liver? And that will make us understand why do patients present like they present? Why do they present with certain symptoms? Because something is wrong with their liver. 80% of the liver is redundant liver tissue, so we can theoretically lose 80%.
Because we've got such a small team, we wear many hats. Having the team come over and having face-to-face interaction with the staff, it gives us an opportunity to ask some of the questions that we would want to get prompt answers for, especially when we don't have the specialty in the area of liver health.
Drink alcohol, because the 20% is not enough, 19% will then tip them over the edge.
Most of liver disease is completely asymptomatic. So your job, it's like Sherlock Holmes, is who has liver disease? In this room, we know that there isn't a lot of hepatitis B in country, but I bet you there's more liver disease than you think.
How super easy is it for us to procure the medications for the management and treatment of patients?
We have fundraised to cover any costs you might have for the medications you have going forward for the next 5 years.
Messaging has been, we'll help you set up. What do you need for us to help you set up? Only if you feel that it's sustainable beyond what we can do in the beginning. We don't believe that our role is to take over. Our role really is to trigger and help implement a new program and for it to be integrated into the current systems. So one of our primary goals is to ensure that the drugs are on the essential medicines list, and that means it becomes part of the nation's healthcare budget. So just because you have Hep B doesn't mean you have a death sentence, and this is a really important message as well, because if you have Hep B and you don't know what it means, then you might think that this is it, my life is over. And if we can't counsel our patients and give them the right information, it will have such an impact in their lives. I have patients who have said to me, I'm not going to get married, ever, in case I give this to my partner or their children. And that's because they got the messaging wrong somewhere in their life. And it's really sad.
When I first heard back in 2012 that I have the hepatitis B, it was very stressful, and sometime at one point I wanted to just end my life like that, because I don't know what to do, and I don't want to live and pass it on to my families or pass it on to my kids. It's very stressful. Yesterday when I was finally getting to hold the bottle, the treatment, yes, I was thinking back. Maybe it was God's plan all along. Like, when I was crying every day, looking for help, now I know that He heard me. Which is why I think it was a blessing for me. It was a blessing for me to come to Niue.
Niue is located in the South Pacific. It is one island, one main island with a population of less than 2,000 people. We have one hospital. We have two schools, one primary school, one high school. We have churches, of course. We are a Christian nation. We have lived off the land, the sea. We're surrounded by seas. Everyone knows everyone. That is what makes us, I think, stronger as a community. These are our families, these are our uncles and aunties, nieces and nephews. So we need to make sure that we look after them. Our doctors have to deliver primary, secondary and tertiary medical assistance or health assistance. The GP that you would see in New Zealand, for example, would refer you to someone else to do a C-section. These doctors have to do all of that. In an emergency, everyone comes together. You've got to do it. One loss of life it's a big deal here, for a population of 2,000, We appreciate what we can do, we do well, but we also got to make sure that we, as much as possible, protect the health of our people and invest in things that would prevent disease in Niue.
Do you have GPs or family doctors out in?
This is it.
This is it. Yeah, I thought so. Yeah, you're it.
What about ECG machines, ultrasound?
We've got 2 of them.
WHO has been forthcoming in providing some support for training. So it would be worthwhile to explore that avenue.
Our issue is finding a replacement for us when we go across for training.
Yeah.
Or just trying to find a budget to get them to come and conduct the training here.
Yeah.
Yes.
We have a small cohort of patients with hepatitis, and they'll need an ultrasound every 6 months. So that'd be great if you could help us out with that, so that anything that we find, we can have early diagnosis and linkage to care in New Zealand. Yeah. So do you have Hep B test kits on site at the moment? What do you have?
No, we don't have any.
Yeah, so
You've run out?
Yeah.
Okay, so what happens if with your pregnant women who need antenatal testing, you just wait for your next batch?
So we collect samples and we send it to Auckland, Lab Plus.
For Hep B surface antigen testing?
Yes.
Is that standard, or do you do any of your in-house?
Well, they used to do it over here, but we run out of the kit, and that's another issue, ordering stuff.
Right.
When we order stuff, it will take a long time to get here, but sometimes somebody has to pay for the stuff.
For the test kits.
Yeah.
There are going to be challenges. You're going to have issues along the way where something happens, your patients disappear, or you've run out of kits. Our only suggestion, and you're much more resilient than we are, is you just keep going. You just take the hits and you just keep going. I think if we gave up the first time someone said no, you can't do that, I think we wouldn't be here today. I think no is a relative no, and I call it kicking shin. You just kick hard enough, long enough, and they just get sick of you, and they give you what you want, or you just find the next shin to kick. We just got a donation of a FibroScan because I kept kicking the same shin. And they said, how much can you afford? And I said, nothing. If you make me pay for this, I can't donate the drugs to these countries. And so they came back to me and said, how about this machine? I said, oh, how about the better one? And I kept thinking to myself, this is not good. They're going to just cut me loose. But then I just got an email this morning saying, yeah, the machine's ready for you. We just got a donation. It's just awesome. So believe in what you're doing. We're not doing it for us. We're doing it because there's a need. We've got the FibroScan machine here. Would anyone like a FibroScan done?
So head up the site and, okay, so just pull your top up for me. Okay, so now I tap your liver out.
We are talking about a disease that is rampant. There are nearly 1 million deaths per year from hepatitis-related complications. One person dying in less than 1 minute. But the exposure and the understanding and the awareness for this illness is still not there.
Having countries achieve their elimination goals definitely causes a snowball effect because countries look at their neighbors and decide what they should be doing in terms of health and other social issues. So it's so important that we have these kind of vanguard countries leading the way in the global fight against hepatitis.
There are places within countries, in remote islands, where patients may not have access to testing, and we want to engage that cohort of patients. Okay, so then it becomes very nuanced about that special population. Okay, so let me give you an example. We have a population in Kiribati and an outer island where the prevalence of Hep B is around 16%. Because the prevalence is so high, it's just not acceptable. And the only way we're going to be able to control the disease is pure elimination, get rid of the virus on the island. So everyone that has hepatitis B, confirmed on a surface antigen, goes on to treatment. Some of the medical assistants don't have all of the technology. They don't have the ultrasound, they don't have the AST, they don't have the platelets, they don't have the APRI. And you don't want to wait till the patients are decompensated and they're obviously cirrhotic. So this is what we are proposing. So in places like that, that is a model. I and our team, and I'm sure all physicians, believe that every individual should be given the best potential care. And that means that they get access to the best diagnostics, best clinical assessment, and the best radiology, the best medicines that's available. But sometimes when those things aren't available, you have to work out which steps can you skip and still be safe and do the right thing. And as long as you've done all of those things with due diligence and explain that to the patients and also make sure that you're engaging within the local sector, then you have to do that, okay? You just can't say too hard. You can't have drugs, which is safe, because we don't have a viral load test. And you're never going to get access to a viral load test. Or maybe you'll get access to it in 5 years. And maybe by then it'll be too late. So I think you've got to think about ways to ensure that there is equity in healthcare. And that's kind of why we feel so strongly about this program.
So with the meeting closing, Hazel, would you like to come up?
This presentation will create a resource that can be shared in remote locations for people who couldn't attend this whole session. We will package it up really beautifully and make it something that's a real tool. Alice has so much experience in the Pacific with much higher rates, and we needed to find out what's different about Niue. And what's different about Niue is your people and how you have handled the public health challenge and how you've structured your public health system. It's absolutely exemplary. It's not just the Pacific that's going to learn from this, it's the entire world. We're going to take this message to the world. What Niue has done is extraordinary, and we would love to see this broadened and widened for the future. However, we still want to really do something to help those 12-20% of people who are living with the virus that need help, treatment, connection to care in other parts of the Pacific.
A lot of the Pacific Islands have so many challenges. And if you look at the challenges in sort of categorical ways, from a healthcare point of view, you have the financial challenges. There's a very limited healthcare budget, so there's no money for this. And we have to carve out a section of the healthcare budget to implement some of these programs. You don't need an army, you just need a trigger. You need these champions, and each country, you just need one champion. And one of the most really profound conversations that we had with one of the ministries of health was, we've always known that this was important. We knew that we need to invest in this, but we just didn't know how. And you made it so simple. And we just linked in the various components of the program, and it worked.
I think it can be replicated. I just think it opens up a whole new opportunity for these people to have life, and life in abundance.
I think the simplicity of the model is really what appeals. We're not talking about huge costs. We're also not talking about huge technology, but we're talking about something that's fairly simple, fairly easy.
What we've been able to do now is to really slim down the program so it is highly cost effective.
The World Health Organization Pacific region has been quite active, has been a real partner in this effort. Unfortunately, the World Health Organization is chronically underfunded.
There are few diseases that we can realistically dream of eliminating, but hepatitis is one of them. Sustained funding, relentless advocacy, and visionary political leadership will be essential for realizing that dream.
And the question is, how do we scale it up, right? And how do we do more of it? And so I think that's why this publicity part is in fact important, to make clear to people it's possible. Come join us.
We should move on to the bigger nations, the Cook Islands, Tonga, Samoa, where there are tens of thousands of people living with hepatitis B without knowing it. We should use the same approach, getting in there, approaching the communities, getting local government support, and providing the local people, the local healthcare workers, with the education and the know-how, the testing, the funding, so that they can do the mahi. They can get out there, do the testing, and they can start treatment. But we need to help them. They don't have access to testing, they don't have access to treatment. But I believe the only way this is going to be taken up and embraced by each of the countries is by providing them with the means to do it themselves.
I've always seen Niue as a world leader. I know we're small, but we can punch above our weight. We are so fortunate to have the passionate people within our health sector that work closely with our communities, and that's also an important part, the relationship with the communities, the trust that's built, and the desire to look after ourselves. And I'm so grateful for any development partner or any agency or any one person that wants to work with us to achieve those aspirations, to look after my people.
It's showing that we care about our people, even though this is a small ratio of our population that's affected. And it shows us as a small nation being a united front for the rest of the world.
I think we were grateful by the fact that a study was done a couple of years ago, so that became somewhat like a baseline for what we're doing now. And we're also very happy to see that the numbers had also decreased over time. So we've gone from 11.9% to where we are at now, which is 0.1%, I think, yeah. So, yeah, we grateful for the team who had gone ahead and done the serosurvey study before us. So I guess this project just sort of strengthens what had already been done, making sure that we do not leave anyone behind.
It was sensational. It was amazing. I think the word can't describe how I felt. I felt so emotional when we moved from just exchanging a few emails to the support that Hazel and the team from Global Health here are giving us. Also the support from our other agency like the World Health Organization, South Pacific Commission also helped us.
I want to congratulate the government Niue for their commitment to elimination of viral hepatitis and doing something for their own citizens. That's what's really important, is people are suffering and governments often sit back and watch, but the government of Niue actually took action to eliminate that suffering. There are curative therapies, there are medicines available that will reduce the burden, it will reduce the progression of the disease, and eliminate transmission of these viral infections. I want to congratulate you for being bold, the citizens of Niue, for being bold, coming in for screening and getting treatment. We don't have to live with these infections.
I want to share to someone that has hepatitis B, don't give up. There's treatment. Just hang in there.
I never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has, and that's a quote from Margaret Mead. You know, people talk about, wanting a better world, but it really starts with us.